What if I end up saying something that only worsens the situation? The focus of today's webinar, hence, is on distinguishing between clinical and non-clinical forms of anxiety, identifying the markers of a panic attack, and developing a response strategy. What is it that I can do when I myself or someone else is experiencing anxiety or panic? There is no one better suited for a discussion on the said topic than our panelists for today, Dr. Garima Srivastava and Dr. Ruhi Satija. We welcome you, ma'am. Our first speaker for today is Dr. Garima Srivastava. Dr. Srivastava is currently an assistant professor of psychology at Aryabhat College, University of Delhi, and is the practicing counseling psychologist and psychotherapist. She completed her bachelor's and master's in psychology from University of Delhi and her PhD in clinical psychology from the prestigious All India Institute of Medical Sciences. Dr. Garima has had extensive experience of working as a clinical psychologist at AIIMS and at Dr. Ram Manohar Lohia Hospital. She has authored and published many research articles in journals of national and international level. Our second speaker, Dr. Ruhi Satija, is a consultant psychiatrist. Our second speaker, Dr. Ruhi Satija, is a consultant psychiatrist based in Mumbai with expertise in anxiety and stress management, depression, addiction medicine, and women's mental health. She also has her own practice named Divine Mind Clinic in Dadar, Mumbai, with the aim of improving mental health services for those who suffer from mental health issues. She has started her own firm, Decoding Mental Health, which aims at making mental health accessible and affordable for those in need. Starting with the discussion, Dr. Garima, we would like you to enlighten us about the theoretical aspects of anxiety. What is anxiety? What is the difference between clinical and non-clinical forms of anxiety? And the signs and symptoms of a panic attack? Over to you, Dr. Garima.
Thank you so much, Bhavya, and I'm really happy to be here today to talk about something which is so important. And we may think we know about anxiety, but it's always important to... Is my voice echoing?
Ma'am, it's clear to me.
Okay, so I'll continue. Okay, so like you mentioned, I will be talking about the theoretical aspects of the stress that we feel in our everyday life and how is that different from clinical anxiety. And also anxiety has different manifestations, and anxiety is a very broad term within which there could be different kinds of disorders and there could be more clinical symptoms. So my aim would be to try and psychoeducate you a little bit more about these differences. Now, the first thing is something that we do a lot interchangeably. We talk about the term stress and anxiety almost in the same breath, but are they actually the same, or do we need to know the difference between the two? Why is it important to know the difference between the two? So I would start with that. I would start with just talking about what stress means and how we should understand stress. So stress is a very normal, universal experience or a response that we have to situations, and stress in itself is not bad, right? So we use the term stress only for the negative aspect of it, but stress could also be positive, which is known as eustress. So sometimes that little bit of push that you need to finish your assignment, or that reminder that you get to pay your mobile phone bill is eustress, because sometimes that makes you do something and it enhances your performance and it helps you kind of reach your goals to an extent. But stress, when it gets too much for us, or when it overwhelms the existing resources that we have to manage hassles or small obstacles, becomes distress, right? So distress is what we usually understand or call stress. So when we say stress, we're usually talking about distress, things that overwhelm us, or when a resource, whether it's time or whether it's any other kind of resources, get overwhelmed. So now this is the basic difference between, not even a difference. This is what stress usually means, and there could be a lot of ways of managing with stress. By understanding our coping mechanisms, by trying to become more mindful of things that we are doing, making certain changes in our lifestyle. But if I come specifically to the symptoms of stress, is it the same as the symptom that one may experience for anxiety? Well, more or less, yes. Because both stress and anxiety activates the same mechanism within our body, which is known as the fight or flight response. The difference is that stress is more as a response to something that is happening in the external world. So, for example, you have a deadline that you're working for and it's becoming very tight and very pressing. So, initially, you might feel like you have enough time and like watching Netflix and doing other things, and suddenly you feel like, oh my God, I have to do this. So, that could be stress that you're experiencing. But the symptoms may remain the same as anxiety. I'll come to anxiety later. But symptoms such as some muscle tension, headache, the heartbeat going up, your breathing becoming more shallow, sleep disturbance, not feeling hungry or feeling too hungry, all of these things could be the physiological responses. But the fight or flight response remains the same. But stress is something which is located in the external world more than something that you are perceiving or that is happening to you internally. So it could be like something like a deadline, it could be a disturbance in a relationship that you're feeling with a friend or a partner or a family member, even a health condition, like you're not feeling that well, you may be feeling stressed about that because, of course, it's the COVID time also. Even if we get a little bit of a headache or our nose gets blocked a little bit, we start to stress over it, right? So the basic difference that you need to understand is stress is a response to an external factor or something that is happening on the outside. And as soon as that subsides, as soon as you're able to submit your assignment, as soon as things get a little bit better with your friend, as soon as your cold recovers, the symptoms also get better. That is the basic difference between stress and anxiety, and I'll be coming to anxiety. So, some things help with stress, like handling it head on may help. Working specifically on your assignment, fixing your sleep cycle, improving communication, all of these things will help reduce. Because we are specifically trying to reduce all the pressure around that external factor that is causing the stress. But stress can also become prolonged. So there is a concept known as chronic stress, which means that when you continue experiencing stress because of multiple life events that might be stressful, like for example, I'm already feeling overwhelmed because of some deadlines I have. On top of that, I have a breakup with my partner. On top of that, there is a health condition that my family member is going through. On top of that, there might be a financial issue that's going on. When all of these go on for a longer period of time, it becomes chronic stress, which is different from this day-to-day stress, which may require for us to seek help from a psychiatrist or a psychologist, right? Now, how is this different from anxiety? I've said that the symptoms seem to be the same, but I did mention that in stress, it is the external factor that is causing it. Now, anxiety is more of a person's specific reaction to stress. So, the stress may trigger anxiety, but the origin is internal. So, it's more to do with, it's a characteristic, it's more to do with the persistent feeling that we have over a period of time of some apprehension or some dread that something may go wrong, something is not right. You're just feeling very threatened. Now, this threat may be real, but it may be perceived. That is the biggest difference between stress and anxiety.
सर फोन वाले चेक करके फोन पे क्या क्या कर सकते हैं अगर डाटा एंट्री अगर नहीं वो है
factor and other people to understand that this person is undergoing stress. But anxiety, on the other hand, is something that you appraise or you internally look for your own self, and something may feel very threatening, but may actually not be threatening. But I don't know whether I can call it a beautiful thing or something which can actually cause a lot of trouble, is that the brain doesn't know the difference between the real and the perceived. The brain doesn't know whether there is an actual tiger out there, or you're looking at a picture of a tiger and you're feeling threatened. Or let me give you a more everyday life example. You once felt cornered by someone in a particular place and you felt intimidated by them, and now every time you cross that place you have feelings of extreme anxiety, and you may not even want to cross that area, you may start avoiding that. The brain doesn't know whether it's real or perceived, but because you're feeling anxious, the fight or flight phenomena gets activated, which means that there is more blood that is pumped, there are more nutrients which are released in your bloodstream so that there's more energy, and automatically some other functions in your body shut down temporarily, right? So whether you stay there and you fight or you decide to flee, either ways, there is a lot of disruption that happens internally. And repeatedly, someone who experiences anxiety, not stress, anxiety, which is more to do with perceived understanding of a situation, and the same fight or flight phenomena happens to keep repeating, it can lead to a so-called nervous breakdown or an exhaustion, or the person is so much on their toes all the time that they're not able to concentrate, they're not able to focus on other things because all of their resources are directed towards dealing with this perceived threat that for them is very real, right? So the thing with anxiety is that there is no passing or subsiding of that event. With stress, that happens, that your deadline is done, your exams are done, and you can feel relieved again. But with stress, there is no such thing as a timeline or when it will stop. So even if that episode has happened and it's passed, but in your own head, you are still reliving it and it's still alive and you're feeling the same symptoms again. No, anxiety in some, so this is what is more of specific anxiety or clinical symptoms of anxiety. But if anxiety in some cases get accelerated or it becomes more severe, it can even become an anxiety disorder. Now, this is also something that people, all of them don't understand. They start using these words very loosely. Like you mentioned in the beginning, that feel like overthinking is not equal to panic attack, or overthinking is not arranging your things a little bit and feeling anxious about it doesn't make you it doesn't diagnose you with an OCD. So that kind of a thing we need to understand, that clinical anxiety is something that becomes clinical when you have certain symptoms that a mental health professional will diagnose for you. You will not diagnose for your own self, right? So if you have palpitations and if you feel like something wrong is about to happen and the anxiety is too much for you to manage, it may or may not be an anxiety or a panic attack, right? So I think it's also important for us to understand that all the things that you feel are real, they are very valid. Nobody should invalidate or trivialize what you're going through, but sometimes, over analyzing or labeling ourselves can also be harmful. So if I look at it in this sense, before I come to what panic disorder is and what are the features of panic disorder, I would very quickly just take you through the major points of difference between stress and anxiety. So stress is something which is short term and it is in response to a recognized threat. The threat is very recognizable, it is out there, and even other people in most of the cases, of course, they have to be understanding and empathetic, but they are able to look at that and understand. Anxiety, on the other hand, lasts longer and may not have an identified trigger. There is no one trigger. Sometimes people who experience panic attack, I'm not talking about anxiety attack, but panic attack, it comes out of nowhere. So many of my clients would tell me that, I was just exercising or I was just having a meal and it just happened. And that in itself must be so scary that, you don't even know where it's coming from, right? Now, another difference is that when stress happens, some symptoms of stress are different from that of chronic anxiety or more clinical anxiety, right? So things like anger, irritability, and all of that happen in stress, but in, say, an episode of panic, the usually feelings of uneasiness, faster heartbeat, heavy breathing, this feeling of heaviness of chest, choking, something wrong is about to happen. They may even feel like they might die. It is just, that immediate feeling that they get. That may not happen with stress, right? So with stress also there is the heart rate going up and breathing becoming very shallow and irritability and nausea and stomach disturbance. But while the attack is going on, there are more specific symptoms that the person feels, right? So now, what is a panic attack? I'm not saying panic disorder, because the criteria for panic disorder is even more specific, because you may have, like a certain number of panic attacks should have happened. There should be a certain frequency to it. So I'm not getting into that. But yes, a lot of the things that a lot of young people feel is that I'm feeling extremely anxious. Is this a panic attack? Did I just have a panic attack? So what I'm going to tell you is what are the clinical symptoms of panic attack that we look at, that probably Dr. Ruhi would look at, or I as a therapist would ask my clients about. So that basically it's an episode of a spike in your anxiety. So there is this episode of extreme anxiety that you feel, which is causing you a lot of discomfort. So it starts slowly. Panic attack, people usually only focus on the peak, and the peak doesn't stay for too long. Like panic attack usually ends in 10 minutes, but it just seems so long because all the feelings are so hard. So one of the things to remember is that it slowly builds up and it peaks in a few minutes, but it should have at least 4 or more of these symptoms that I'm going to be saying, okay? So the heart should race, there should be palpitation, sweating, trembling or shaking. Okay, so they could be like shivering, shaking, trembling, shortness of breath, a feeling like you're being choked, right? Or like like you feel very difficult. You feel that difficulty in breathing, chest pain or discomfort in your chest. That's why a lot of people feel like they're having a heart attack when it's actually a panic attack. Nausea, extreme nausea, dizziness, chills, or like sensations of feeling very hot. A feeling of derealization. You don't know what is happening. You feel very disconnected with your reality at that moment, and a fear of losing control. A person experiencing panic attack may have some of these, may not have some of these, but at least 4 of these have to happen for it to be a panic attack. Along with this, okay, because there is also anxiety attack that I'll come to. Along with this, there is also a fear and worry about having an additional attack. So it doesn't end there. The person starts to dread it so much that even when they're doing regular things, they keep dreading that what if it happens again? And the place where it happened, there might be an avoidance of going to that place. Since there is no trigger, the person who experiences panic attack gets very worried that it will happen anytime. And since it happens, say, in a mall or in a exercising, like a gym or a jogging track, they may start avoiding going there, which in itself keeps reinforcing the anxiety rather than the anxiety going away, right? So they change their behavior significantly in order to avoid the anticipated attacks in the future. And it may not have an obvious trigger. I'm not saying it never has. Sometimes it does have an obvious trigger, but many of the times it doesn't. And so it peaks and it falls, right? Now, people also confuse panic attacks with anxiety attack. So anxiety attack is just feeling extreme anxiety because you're already stressed about something and something triggers it, right? So it's usually easily started. You can mostly identify why you're feeling that extreme form of anxiety. And there is more stuff like dryness of mouth, maybe sometimes a little bit of chest pain, you feel easily startled, fear, irritability, shortness of breath. But things like realization, feeling of losing control, this feeling of choking is usually not there in most of the cases of anxiety attack, right? So the biggest difference is panic attack usually has no trigger, but anxiety attack usually has a perceived trigger. It may not be a real trigger, but it's a perceived trigger. Like, for example, somebody who's had a traumatic experience may have a nightmare, and they may have flashbacks, and they may, in anticipation of the nightmare, may start to have anxiety before sleeping or an anxiety attack before sleeping. So it may be a perceived or a real threat, whereas a panic attack may or may not have a real threat. Panic attacks are usually very extreme. There is no mild panic attack, whereas an anxiety attack can be in a range of mild to severe. You could have mild anxiety. For example, you hear something or something disturbs you and you're already feeling stressed out about something, and you just feel like you're having the shortness of breath and you're feeling like you're losing control. But it's not a panic attack because you also understand where it's coming from, and usually it kind of ends and you're able to understand what happened. But in panic attack, it happens suddenly. It does subside, but it leaves this feeling of intense fear that what if it happens again, right? Now, also, it's important for us to understand that firstly, what I said about labeling, that just because you experience anxiety, firstly, try and differentiate whether you're having stress or you're having anxiety. Because stress, like I said, is more identifiable, it's external, it's out there. Anxiety is more like a perceived threat, it's more internal. It doesn't end or subside after that particular event or thing is over, if it's supposed to be regarding that. The second thing is that just because you're having anxiety, you shouldn't be in the either extremes. One, that you don't talk about it at all, or you get extremely worried or worked up and you end up diagnosing your own self, or you start reading online. Because, like I said, the symptoms are so similar. You may type something and you may get something else out of that. And that may make you feel like you've had a panic attack, whereas it may have been an extreme form of stress or an episode of anxiety. So I would say that it's always better to be somewhere in the middle, where you do try and find the right person to talk to about something like this. Of course, the person that you talk to should be someone who is genuinely invested in listening to you. Or if you see this happening to someone else, also the best way to start a conversation. Of course, if you see someone having an extreme bout of anxiety or panic, you are probably just offering them water, helping them kind of breathe a little at that time, and whatever you need to do at that moment, which Dr. Ruhi will be covering in her segment. I won't get into that, but I think first letting that pass and then deciding to talk to someone who is equipped. So, for example, if you're confused whether your fever is high or low, or whether you should take an antibiotic or not, you usually talk to a doctor, right? Or you usually talk to a family doctor, a physician. Similarly, please talk to someone who will be able to help you. I know there is stigma attached to labeling, but mental health professionals these days, a lot of them are also very sensitive to this need. So I think it's important for us to understand that having An episode of anxiety doesn't make us people who have anxiety disorders. There is DSM-5 and there is ICD that is used to make that diagnosis, and we don't have to do anything about that. And even if you're experiencing something like this, there is always a management technique. There are always ways to deal with it. So I think this is where I would like to end, because Dr. Ruhi also needs to now probably take on from here and talk to you about the ways in which these symptoms can be managed.
Thank you so much, Dr. Garima, and thank you so much for making it so relatable by adding so many examples. And I feel that the subtle differences that you talked about between anxiety attack, stress, panic attack are so important, not only for the experiencing person, because obviously I need to know what I am going through, but also for that person, all those people this experiencing person is interacting with. Because at least for me, this has happened with me, that a lot of times the people around me have sort of nullified my experience, that ye tension lete ho, ye to hota rehta hai. Yeah. Which is so wrong, and I really like the fact that this psychoeducation is not just reaching those who are themselves anxious, but also those who might be interacting with people who have such concerns. Thank you so much. Now that we have the theoretical grounding in place, I would like to invite Dr. Satija to shed light on the self-help strategies to manage everyday anxiety. And as a layperson, what can I do to respond to someone who is experiencing anxiety or panic? Over to you, Dr. Satija.
Hi, hello everybody. Really nice session, and thank you, Bhavya, for the introduction. Dr. Garima explained the topic in a very simple way, and I think it's more or less clear for us what are the subtle differences between having a stress, anxiety, and panic. And I would like to go in the same series when I'm talking about the treatment for the same. So, there are two things that we have to consider. One aspect that we are looking at is that what we ourselves can do if we are facing the similar situation or somebody that we know, although we are not an expert in the field. Otherwise, when it is that you need to seek an expert, these are some of the questions that I am going to cater to today. So let me start with one point which is really important to understand, that yes, anxiety is a very unpleasant experience. Yes, stress nobody wants to have, but you have to understand that stress and anxiety is essential. If we did not have stress, if we did not have anxiety, let me tell you that human race wouldn't exist.
Ma'am, you are not audible.
I am not?
She is audible, I think. We can hear her.
Hello?
Is it better?
Yes, she is audible.
Yes, we can hear you. You can
okay. I can continue?
Yes.
All right. So you need to start with understanding that anxiety and the stress mechanisms, the one Dr. Garima mentioned, that we have a flight and fright response, it is essential for our survival. So when humans were made, when we were in an early man stage, this response was, biologically fit in us to protect us from certain factors which we have in the environment. So for example, in early man, that our lifestyle used to be that we used to stay with jungles with a lot of, natural threats such as wild animals, and we had to face them on daily basis. The main source of food was hunting, and we were facing such threats every day. So this response is what that used to protect us. If we see a wild animal, we would, naturally get the instinct that this is not something that I want to go near. This is something that I have to protect myself from. So I would either run away or I would fight, right? But what has happened with the evolution and with the advancement in human life, especially the life that we are living today, it is very recent. Maybe, last 100 years only, when we have so much technology, when we have so much social skills, and, society is improving so much that we do not have to face these natural threats every day. But what has happened is that biology system is still there in us. So even if we get a little bit of stress, everything will cause stress in our life. Even if we have to do a simple task, it causes some sort of stress in the body. But the reaction in some people gets very overwhelming. It is the same as if you will face the lion, right? That's when the problem becomes difficult to handle. That is when it becomes a problem. Otherwise, it is actually required. Like Dr. Garima had mentioned that if we have mild stress, it actually makes us achieve something. It actually makes us do something to, reach our goals, to accomplish something in life. Similarly, we have to understand that constructive anxiety, constructive stress is not bad for us. It is essential. Now, starting with that, how to prevent it from becoming an essential part of our life to it becoming a problem in itself. The first point that we need to understand is that we have to welcome the constructive anxiety. We don't have to fear it. We have to understand that all of us at some level or other, at some point of other in life, we are going to have some sort of anxiety. Second thing that you need to absolutely understand today itself is that it is a temporary feeling. It is not permanent. For example, in panic attack, Dr. Garima had mentioned that one of the differentials that we have, one of the feeling that people have is that they are getting a cardiac arrest, heart attack, which is actually the commonest differential diagnosis that we see when we are having a panic attack. But if we understand that we have a panic disorder and this can happen to me, but I know that this is not something permanent, it is not going to be fatal for me, it will reduce some sort of anxiety. Okay. Now, talking about stress management and anxiety management, what we can do on our own. The first thing that you have to understand is being proactive instead of being reactive. What that essentially means is if you already experience that you are having some sort of stress, a little preparation, some of the activities which help you preventing getting some anxiety is always essential. Make that a part of life. For example, having a healthy lifestyle, having some 30 or 40 minutes of physical exercise, some natural food, especially for the people who have anxiety, having more oily foods or junk foods is known to be associated with increasing the anxiety, right? Second thing that you have to do is, for example, if you have work stress or office stress or college stress, you prepare first. Many times what happens is because we fear the task itself, procrastination becomes a common symptom. What we do is we delay doing the task till the end, and that delay causes the anxiety in us. Next thing that we have to face is that we can also have a fear of having anxiety. So if somebody has had an attack of anxiety, for example, in stage fright, this is very common. If you have to face an audience and one time you had a bad experience, you are so anxious that going there itself doesn't become an option for you. Okay, so little bit of preparation on your end, changing your lifestyle a bit so that you are less stressful, preparing beforehand so that in the end you don't have too much on your head and it makes you stressful is something that you have to make a daily routine so that you do not expose yourself to essential stress. Second thing that we have to do is that now if we are having stress, what are some of the techniques that we can use to make ourselves feel better? For that exercise, what I would like you all to do is, I can't see the camera screen, so I hope you can do it. You need to put one hand on your chest and one hand on your belly. Okay? And when you breathe in, just notice whether it is your chest that is moving or whether it is your belly that is moving. When you inhale your breath, one part will go forward. Just notice which one is it. Some of you will have the answer as chest. Some of you will have the answer as belly. So, is there a difference? Is there a relevance to this point? You have to understand that when you are relaxed, in a relaxed state, it is the belly that moves. If you are anxious, if you are stressed, it is the chest that moves. Okay? A relaxed state, belly should move. In a stressful state or anxious state, the chest has to move. But we can use this knowledge for our benefit. How? If we forcefully or with some exercise change our breathing pattern, we instead of a chest going forward, we make sure that the belly goes forward. We will automatically send the feedback to the brain that we are relaxed. then even though the mind is stressed, it will get the body's signal that no, everything is okay and we are supposed to be relaxed right now, and automatically anxiety starts coming down. This technique can be used with a lot of different variations. For example, there is a technique called box breathing, and then we have pranayam. It is a very common Indian technique, we all know that, and then that opposite nostril breathing. Otherwise, we have 2:4 breathing, which essentially means that when you are inhaling, you count 2, and with a count of 4, you exhale. The exhalation has to be double than the inhalation. What that will do is it will bring the stress level down. The cortisol hormone, which is causing the stress, reduces, and automatically you start feeling better. The box breathing that I have mentioned, what that is that on a count of 4, mentally counting 4, you inhale, then counting 4, you hold your breath, then counting 4, you exhale, and then counting 4, you hold your breath. So we made a box. Inhalation, holding your breath, exhalation, holding your breath, all on a count of 4. That means all the phases are with equal time. When you do this is a wonderful technique. When you will do in the phase of an anxiety or stress, you will automatically feel that you are feeling a bit better and the stress is reducing. But essential is the breath has to be from the belly and not from the chest. Okay? This is the second thing. Then another techniques that you can accommodate in your daily thing. One of them, very important one, is progressive muscle relaxation. You can easily find videos on YouTube and internet where there are guided progressive muscle relaxation sessions. These are essentially 10 or 15 minutes, in which what we do is from the foot to the head, we focus on one muscle group at a time. We constrict it and relax it. This is called progressive because it is coming from the foot towards the head. Muscle relaxation. One body part at a time, one group of muscles at a time, we focus and then we relax each of them. This technique has been proven to be very, very effective in chronic stress and people who have, a tendency to get anxious. What you can do is you can at least once a day, preferably twice a day, morning and evening, start doing it. Make it a part of your routine. What you can simply do is the minute you wake up, you can just put your headphones and do it on your bed. Otherwise, before sleeping, once you're going to the bed, you lie down, you do it and then you sleep. You will see that in a span of 2 weeks, it takes around 1 to 2 weeks to have, a continuous effect on your body. You will see that comparatively, your body is much more relaxed and you are much more relaxed. Apart from this, meditation and yoga have been proven to be very effective in managing long-term stress. And one new technique, it's actually not new, but it has come up very recently in focus. It is mindfulness-based therapy. What mindfulness essentially is, if any one of you have experienced anxiety at some point of time, if I ask you that what was the anxiety about, I'm sure that the answer would be either something in the past, some regret from the past, some trauma of the past which keeps on playing in the head and makes us feel uncomfortable, or the thought is about something in the future that we are fearing, some uncomfortable situation that we are thinking is going to happen in future. So now, if the stress and anxiety is about the past and future, what we can do is bring our attention from the past or future to the present. That is the basis of mindfulness. What we do is, whatever tasks you take, for example, you are eating your food, you are washing your clothes, you are reading, whatever you are doing, what you do is focus on that task in hand. If you are eating your food, don't just put your bites in the mouth and gulp it. Take that moment to notice the taste, notice the temperature of the food, notice the texture, how it is feeling in your mouth. Chew it longer so that you are putting your attention to the food and your mind is not wavering from past to the future. Okay? This technique, if done regularly, will help you bring your stress levels much more down. apart from that, now we have done something that, will continuously, if we do, it is going to help us. Now, if somebody asks me, right now I'm having anxiety, I don't do meditation regularly, now what to do? Okay. So in that moment of feeling anxious, one technique that you can use is called grounding technique. Grounding technique essentially means that you use your senses to focus in the present moment. So the count is 5, 4, 3, 2, 1. 5 things, immediately sit at a place with your back straight. It's a quiet place wherever you can find. Notice 5 things around you that you can see. Anything, and mentally count them. Simply a chair, a pen, a bed, a floor, a fan, whatever is there in front of you. Then you think of 4 things that you can feel right now. Maybe the clothes that you are wearing, maybe something in front of you that you can touch and feel what it feels like, right? 4 things that you can feel. Then focus on your hearing. 3 sounds, any 3 sounds in that moment that you can listen to. Notice them. 1, I'm hearing something from the road. 2nd, I'm hearing somebody talking in the next room. 3rd, any sound, any bird or anything that you can recognize at that time. Then 2 is smell. Any 2 smells that you can notice in that moment. And the last one is taste. You can keep something with you. If you have a tendency to get anxiety attacks or stressful, you can keep some sweets or some mints in your bag, and anytime you feel anxious, just put one in your mouth and focus on the taste. Engaging these 5 senses, the seeing, feeling, hearing, smell and taste, it will immediately bring your focus from whatever is going on in your mind to the present moment. Okay? These are the techniques that you can use to feel better. Now, lastly, I'll come to the thoughts, because that are essentially what are causing all of this fuss, right? If it is a mild anxiety, there are a few things that you can do on your own. First thing is finding the thought which is underlying cause of the anxiety. So, for example, if we are stressful or anxious about an exam, it is not the exam that we are fearing, it is the result. Otherwise, it is what people will say. Otherwise, it is how will I look if I don't score that well. Whatever your assumption is, what you do is take a notebook and pen. You can even keep a thought journal. If you do have tendency of overthinking and feeling anxious, make a thought journal. What you do is, on the left side of the paper, you write down all your assumptions which are causing the anxiety. Take a moment with yourself. You will notice. I'm anxious about what my father will say. I'm anxious about what my family will say. I'm anxious about how people are going to see me. Write them down. Okay? Then close the notebook, go out and distract yourself for a few minutes, then come back. Okay? Take 10-15 minutes and then try to logically look at that thought and find a practical solution for it. Otherwise, if there is some logical thought behind it, for example, if I think that if I fail, everybody is going to think that I am a failure, right? At that time, definitely this is what I am feeling and it is making me anxious. But what I can do is, later on, when I feel calm, I can think that people really have better things to do and not focus on what I'm doing with my life. Even if I fail in this one exam, does not make me a failure, because definitely I have many things in my pocket which can show that I am an achiever in some aspects. Like this, having some logical counter thought is going to bring your anxiety down. Okay? Apart from this, one more practice that has been scientifically proven to help you with any sort of negativity, any depression, anxiety, stress is gratitude. Writing 3 things every day in the day that made you happy. It doesn't have to be big. It can be as simple as that you had your favorite noodles, or your coffee was good, or somebody smiled at you from whom you didn't expect a smile. Any small thing. Now what this will do is, and that day it might not sound very significant, that what's the big deal, I have coffee every day and every day it's good. But what happens is, in the moment when you are feeling negative, when you are feeling low, and the brain is clouded with all these imaginary thoughts that everything is going bad, this notebook, it's your handwritten notebook, becomes the counterproof. to give you the perspective that everything is not that bad. Some things are surely good. Right now, it's not good. And again, reminding yourself that this is a temporary phase and I can do something about it. These are some of the techniques that you can do on your own. First thing is validating, preparing, doing some relaxation techniques so that you feel better, and talking about your thoughts, or giving them a benefit of doubt and thinking of an otherwise rational thought which would make you feel better. If these don't work, that means it is a clinical anxiety. The best thing would be going to a therapist and going to a psychiatrist. I understand the stigma. The best way to tackle right now, anyways, the new advancement in our country is that everything is available online. You can consult a psychiatrist and counseling session online, and you don't have to go someplace, because I understand that society does have a lot of stigma, and it can be very difficult for you to even tell your family that this is happening. So you don't need to tell anyone. You can directly contact the professional and get help. With that, I finish my discussion. If there are any questions, I would like to answer them.
Thank you, Dr. Ruhi, for equipping us with these quick techniques that we can make use of to manage our stress and anxiety. Thank you so much. I think you've provided us with answers that we've been looking for since the beginning of this lockdown. And as far as my experience goes, the other techniques I'm yet to use and can't wait to use. But JPMR and progressive muscle relaxation is definitely one technique I can vouch for. So now that we have reached a holistic understanding of anxiety, both from a theoretical and practical perspective, I now open the chat box for any questions that the audience may have. So one of the questions that's already there is, does JPMR also help in making the breathing better? Dr. Ruhi, would you like to take that up?
Yeah, sure. So definitely it does help, but all of these techniques will only be effective if used regularly and with some form of consistently, and also for a minimum duration. So for example, if you're talking about JPMR, PMR, or any sort of meditative techniques or mindfulness techniques, maybe that day you do feel a bit better, but it is not going to give you consistent results until and unless you make it a routine. So once it becomes your routine, every day you practice, then only you will be able to use that in that moment of distress, that all right now I'm feeling bad, let me just focus on it and I feel better. That comes with practice. Just like any other muscle that you have to train, these techniques are all require some sort of background training to be effective.
Okay. So we also invited questions in our registration form, and there is one very interesting question. Is anxiety learned or genetic?
You want me to answer this?
Yeah, Dr. Garima can pitch in.
Okay, so definitely we have a genetic basis. Okay, for any mental health disorder, it is a possibility that if in your family there is a history of mental illness, you will get it, but it's not necessary. Many people have sporadic illnesses as well. Their own experiences will cause it. So we have a biopsychosocial model of mental illnesses. We have a biological basis. We have a psychological pattern of thinking that some people are naturally, more worrying in tendency, over anxious or overthinking. And then we have a social model that although they were fine, but the life was so stressful, the environment was so stressful around them that it caused all these symptoms to come. So it's never one thing. It's never that, just because your genetics is so faulty, it is to happen. We get any cause.
Dr. Garima, because you talked about psychoeducation, I think you will be able to answer this question best. How can we teach someone from a rural area about the effectiveness of these techniques?
That's a very good question, because anxiety and stress, like even Dr. Ruhi was just mentioning, that it's something that our social factors also play a huge role, and there is so much of mental health issues that are ongoing even in the rural areas. So I think the best way would be to firstly explain to them in a way that they would really understand. So the context has to be theirs. It has to they should be able to identify with it. And I think in psychology and in research and practice, we really focus on the cultural variables or social variables. So the person who is going to talk to them should be one of them. So we can have, we can train people from their own communities who could talk to them about these things and give them very simple everyday life examples of what they experience. So some of the stress is very collective also, like something is happening in that particular part. It could be a socio-political reason because of which something is happening, or some other reason. So firstly, trying to put it in perspective and then teach the techniques. So I have personally seen, and I've worked with some minorities and certain communities, and I've really seen that if you're able to fit into their context, they are able to understand and appreciate all of these techniques, and in fact they're very forthcoming in understanding. So I think like Dr. Ruhi said, the biopsychosocial model plays a huge role, and looking at the social factors and the psychological factors will help us build certain solutions for them in a way that they would perceive useful.
Thank you, ma'am. Another question is that one of my friends has reached out to me during a panic attack. Is the grounding technique enough, or is there any other technique we can use as a non-professional?
Okay, so grounding technique depends if how much of a level of panic attack is it, and also the awareness of the patient. For example, if somebody has had multiple attacks, they will automatically will be able to channel it towards this and use this technique very effectively. For somebody who is very new in this, it might take some time for them to accept, first of all, because in panic, one thing is that the issue is getting a panic attack. More than that, what we see is there is a fear of getting panic attack, which is the debilitating part. More than the panic attack itself, the fear of getting a panic attack and the fear of losing control of themselves is something that affects their life more. So I take relaxation every day. Taking care of yourself is something that you need to think in these cases.
All right. The next question, or maybe Dr. Garima, you would like to take this up. What can we do when we feel anxious when we are in a crowd? And this is also a question that I personally endorse. I would also want you to answer this because I also have very similar feelings in a crowd.
Okay, so this is anxiety in crowds, right? So I think I would firstly ask them to reflect on a few things, which is that where is this kind of anxiety, coming from? Have they had a certain experience that has led them to become anxious of crowds? Some of us in general don't like crowds, or we avoid crowds, but there is a difference between not liking something and not preferring something, and actually feeling anxious even in anticipation of being in a place that is crowded. So I think the first thing would be some self-reflection about, have they had certain experiences? It could be direct or it could even be vicarious. We always don't become anxious of situations or places just by experiencing it. It could also be indirectly through someone else's account or certain experiences. So how anxious are you, and is it causing any distress and dysfunction is the next thing. So if it's causing you distress, that for example you would avoid going somewhere that is important because it makes you very anxious, right? So is it causing you that kind of distress? Thinking about it is making you distressed, or it's causing you dysfunction that you're avoiding doing things in your everyday life? So, of course, the management part is definitely there. Everything that Dr. Ruhi had also mentioned would come into picture here, which is the deep breathing, the abdominal breathing, relaxation. But before that, I think it's also important to understand where is it coming from and how severe is it. Because I think sometimes we tend to feel like we should be able to manage it. But I think it's also important to understand the cause and how severe it is. So maybe talking to a mental health professional also might be a good idea. Even if you don't fall into a category of any kind of anxiety disorder, I think if it's something that you're preoccupied with, I think it might be a good idea to talk to someone.
Ma'am, so I have a follow-up question here. In the beginning, we had discussed that anxiety usually doesn't have a specific trigger, right? But अब जैसे हम when we are talking about crowds, a crowd is the trigger. So is that still anxiety or is that like public stress? I mean, yeah, we call it anxiety, but there is a very specific trigger.
I'll tell you, I'll just clarify this. So what I said was that there is no real trigger. No, what I meant was that the threat is perceived. So real threat would be something like there is, say, a terrorist scare that is going on and there is red alert, and that is like a real cause of everybody to feel stressed. But if I'm individually wary of going to a mela or going to a crowded market, it's real for me, but it's also perceived in a way because the threat may actually, this threat that something will happen or I'll have extreme anxiety. That in itself is perceived, right? Because the way anxiety goes is it's like a wave. It comes and it goes, but we are just so scared in anticipation that we will feel anxiety that we start to avoid it. So that is what it means. Rather than saying that your absolutely your anxiety is valid, but it's the threat might be perceived because you may start avoiding places in anticipation of feeling anxious, but sometimes it's okay for the anxiety to come and go, and you learn that with time. That is something that happens with panic disorder also, that you realize that it won't kill you, nothing will happen. But of course, I understand that it's very, very difficult at that moment. So that is what I meant. I hope I was able to clarify that.
Yes, ma'am. Yes, ma'am. Now it's clear. So the last question that we'll be taking is nail biting also a symptom of anxiety? Is it always emanating from anxiety?
Dr. Ruhi, will you take it up or should I?
All right. Yes, definitely. Nail biting can be a sign of stress and anxiety as well. Not necessarily connected with all of the symptoms. It might be possible that you have mild stress and this is something you do. And what happens is it can be an unconscious coping mechanism as well. It's not necessary that whenever stress comes, you say start nail biting. It can be, in the back of the mind, you're stressed about something and you do it unconsciously. Sometimes people don't even realize that they are doing that.
All right. Thank you, ma'am. And with this, we have come to the end of our session. I would like to thank both of our panelists, Dr. Garima and Dr. Ruhi, for their time and expertise. We hope our audience enjoyed the session and had something valuable to take back with them. Audience, please don't forget to fill up the feedback form, which will be circulated on our WhatsApp group as soon as this meeting ends. A recording of this session will also be available on our YouTube channel, EmoDive. Please do follow emo_DIPE for updates on future webinars and events. Thank you so much once again. We'll be back with more such webinars for all of you.